Hello, everybody. Welcome back to the Thai Wanderer. Yeah, you guys are probably wondering why there hasn't been any videos or any wanderings in a while, and yeah, truthfully, I've had a lot of a bit of a health issue, which in this video I want to talk about. And you know, from the title, you obviously know that uh, this is probably not the typical trip or wandering video, but I'd like to keep on record and share I think my journey of my whole sinus infection and recovery, which spanned about over around 5 to 6 months. Yeah, it was terrible. It is terrible. So I think for any of you who have had sinus infections or who know people have sinus infections, this video might be of use. It could be useful, and I'll share sort of what I've learned and sort of some of the mistakes and mistakes and good steps that I've made as well. So begin with all this journey. I remember it started around March this year. I mean, we are in October, nearly the end of October now, and I had this sinus. First off, I remember it was in March. And the thing is, what I noticed, before I got sick, I used to have colds and sore throats and all, but most of the time colds would go away on their own. My colds, normally runny noses, would go away on their own, and if you had a sore throat, you might get a short course of antibiotics and it'll go away on its own. This I remember in March, it was a blocked nose feeling. It started off on the left side. Yeah, it was a blocked nose feeling. I thought it was a cold, so of course at that time I was still climbing a lot and a lot of stuff going on with work. So I didn't really take it seriously. I kind of just left it and thought that it would go away on its own. No one else in my family was sick. So it was this sort of stuffy nose on the left side. And this was sort of the third week of March. And I remember towards the end of March, we went to a trip in Krabi. You even saw some videos of, I took a lot of videos of myself climbing in Rai Beach. And even with the stuffy nose, I was climbing just fine. My energy was up, energy was really high. But then I kind of noticed after I got back from the trip, the stuffy nose sort of progressed into having sort of a mucus or phlegm coming out. Yellow greenish phlegm, and then I kind of knew that. I also remember there was some throat irritation. I was coughing slightly a bit, so I was like, okay, the stuffy nose has progressed into a bit of phlegm, mucus, and also some coughing, throat irritation. So I did go to the doctor, and when I went to the doctor, they remember they didn't take an X-ray yet, but they looked at the symptoms and they kind of deduced that it was possibly a sinus infection. So I was prescribed Cravit antibiotics. Cravit antibiotics, just I think one tablet, 500 milligrams, one tablet per day. I took that for about, I think, 7 to 10 days. And at that point, my mindset was sort of like, okay, so what, sinus infection? We've all heard of people who've had sinus infections. We never really realized how bad it can get. And at that time, after the 7 to 10 course of antibiotics, I felt better. My nose maybe wasn't 100% cleared. The doctor said maybe it was just sort of lingering symptoms from after an infection. And after the I think 10 days of antibiotics, I was, I felt fine. I was back on my feet. I was going back to work, like getting back to climbing. And this was now around mid-April. And we're having another trip coming up, going to Phuket during the my kids' school vacation. And I remember that 2-3 days before going to Phuket, I went climbing, and then at night I suddenly had shortness of breath. I was sort of coughing a lot. I felt like my cough had progressed suddenly. I quickly went back to the doctor, and they said I had developed acute bronchitis, which is like, how can that be? I just finished a course of antibiotics recently, and now I suddenly have bronchitis. So, and even that time I thought, okay, bronchitis or throat irritation, throat infection. I've had throat infections before. They prescribed me Augmentin again, Augmentin antibiotics. So first was Cravit and now it's Augmentin, which is a bit, I think, better for throat irritations and throat infections. So had Augmentin, I think, for 10 days, during which we went to Phuket, and I felt fine all throughout the trip. I felt better. My coughing was getting better. I was coughing out phlegm, and which was sort of cleaning out everything in the system. I even went swimming when I was in Phuket. Of course, not putting my head fully down, but I did some swimming and even, very, very short sessions of snorkeling, not going anything too deep. And at that point, I was still sort of like, whatever, I'll recover from this. It's a, throat infections. I've had throat infections before with phlegm. And so I didn't really think much of it. After the Phuket trip, came back, finishing the course of Augmentin, I felt fine. I felt better, improved. But again, I always noticed there was some lingering symptoms of my nose, this sort of constant. Now I know that it's called post-nasal drip, sort of lingering mucus dripping down the back of your throat. And at that point, the doctor was like, oh, it's probably just maybe lingering symptoms. You don't have an infection anymore. So I was like, okay, fine, whatever. Maybe, because sometimes you don't get cured right away after antibiotics. Antibiotics just takes away the infection. And then, your symptoms sort of clear themselves out. So this is now around mid-April, going to the 3rd, 4th week of April. I remember sort of like, the mucus, sort of they call it post-nasal drip or P&D, is not stopping, it's getting worse. And now I felt like I was coughing again. Not as bad as when I had the bronchitis, but there was sort of like, a bit of wheezing sound when I was breathing heavily sometimes. I didn't feel like my breath was fully cleared. And then that's when, and this is now sort of end of April, this is when sort of like it clicked in my head that, I sort of better take this a bit more seriously. And then this is when end of April, then I decided to go to a specialized allergy and sinus specialist, which we have we know a clinic that actually this doctor cured my wife and son who previously had before sinus infection. I said, okay, if they were cured, then probably this doctor would probably help me as well. So, and mind you, this is now end of April, so I've had this since mid-March to April. This is already a month and a half. So end of April, I went to see the specialist. We finally took a proper x-ray of all the sinus sort of, what they call pockets. And that's when I sort of realized that, oh wow, we actually have a lot of sinus pockets inside sort of our head. I think we have the maxillary, which is sort of the ones on the cheeks. We have the frontal on top of the eyebrows. And I just realized that we also have these sinus pockets called ethmoids, which are sort of between the eyes. And they're sort of like honeycombed small pockets. And behind those are also the sphenoids. So you have actually 4 categories of sinus pockets that I didn't know. From the x-ray, however, it was sort of clear that I still had sinus issues. I was really surprised. I went through a whole course of Cravit, went through a whole course of Augmentin recently, and the doctor was like, and I think this is when I probably made the first mistake of not taking the sinus infection seriously at first. But mind you, before I didn't really think I was that sick. I didn't think the idea of a sinus infection never crossed my mind. And the doctor told me that when you have a sinus infection, you need to take antibiotics for a really long time. It's not just taking 7 to 10 days, but you need to take not only an increased dosage of antibiotics, but also a prolonged course of antibiotics. So then we properly took a higher dose of antibiotics. So this is taking it again in the beginning of May, 1st of May, I remember. And this was like, I think Augmentin plus amoxil, so like sort of a double dose of antibiotics. And I took that for a whole month. So the whole month of May, I was on a 4 weeks course of antibiotics. During that time, I felt better. And that's the thing. I think this is the thing that's probably the most frustrating and most, I think, mentally challenging about having a sinus infection is that if you don't really know what's the path to get cured, you end up taking these antibiotics that you feel, you go from sort of maybe feeling 50%, you go back from feeling 50% back to 80%, and you think you're cured, you think you're out of the woods. and then after a while it goes back down. You start feeling worse again, and that's what happened after I finished the recent course of antibiotics, the high dosage and prolonged course of antibiotics throughout of May. Beginning of June, I felt better. I felt fine. I was back to exercising, back going to work. We even took a trip to Paris and UK to go pick up my son who was in summer school. We went to Disneyland and everything. I thought I was I thought I was cured. There was still, and that's the thing. I think this is a good point for all you to notice whenever you think if you're cured enough of sinus infection. Even though I was sort of fully energized, I had all the energy, there was always still that feeling of the post-nasal drip. Always the feeling of that mucus sort of constantly dripping slowly down the back of your throat. And remember, after getting back to the trip, mind you, now this is going now into early July. So I've had this since March, April, May, June, and now going into July. I felt better, but then when the P&D or the post-nasal drip didn't stop, it now continued to make my symptoms worse. My cough came back, even some wheezing of when I breathed came back, stuffy noses came back, and I think this is one of the most probably mentally depressing part of the sickness or of any sickness that I've been through. I think the fact that you think you're better, then it goes back down. You take medication, you think you're better, then it goes back down. You go through this roller coaster wave of feeling good, then bad, then good, then bad, and good, then bad, and mentally it takes a toll on you. Physically, I mean, it wasn't so bad. I mean, it's kind of just a stuffy nose, coughing, maybe not fully energized, but I think the mentally challenging part is the worst, whereby you think you're cured. And of course, I have kids and I want to be able to spend all my time with my kids, take my son climbing, take my little daughter, to the park and run. But I couldn't do that. I didn't feel like I had the energy. And this is when sort of suddenly, my symptoms weren't terrible, but then comes end of July, I developed tonsillitis or infected tonsils. And that's when sort of I was like, well, this is, the sinus infection is not through. So we decided to go through a second course of heavy antibiotics. So now we went on to taking Cravit again, but instead of the usual 500 milligrams tablet per day, we boosted up to I think 666 milligrams tablet per day. So a tablet and a third per day for another month. So at this point, I was like, mentally, I was sort of like really doubting the doctor and everything. And then this is when sort of mid-July, I started reaching out to other doctors nearby, getting their opinions, and I confronted my doctor basically and told her, what the hell is going on? Why isn't it getting this better? She said basically, if you really want to know what's going on, you have to take a CAT scan. At this point in my head, I was like, why didn't you have me take the CAT scan months before? And I think this is the most trickiest thing about having a sinus infection is that probably in most cases, heavy antibiotics probably cures you. I'm sure 80% of sinus infection cases are cured through heavy antibiotics. And I'm probably one of those fewer percentage that are just really unlucky. Because when we had the CAT scan, we then just realized that not only are my frontal or maxillary sinuses, which most sinus infections occur, are still infected, but basically all of my sinuses, all of the categories were still infected. They were all closed up, filled with mucus, in which there was a high chance that antibiotics were not able to reach those deeper sinus areas. So at that point, sometimes I think with health and seeing doctors, you kind of have to sometimes not follow your doctor all the time when you realize that they're not really helping. And now it's July. It's been 4 or 5 months already. I reached out for second opinions right away, and other doctors when I went to see these other renowned doctors. And I think this is when I started to sort of, me and my wife helped me in terms of seeing the history of different ENT doctors. And we found one nearby that has very good experience and is very well experienced in the ENT field. He looked at the CAT scan. Immediately he said, "There's no way this is getting cured without surgery." And that's, I think, was when I had sort of just a really big shock whereby like, what the hell have I been doing with all these antibiotics? If surgery was a solution, why didn't I have the surgery 3 months ago? So I think the trickiest thing with sinus infections is that doctors normally don't prefer surgery. They normally recommend surgery as a last resort. But then again, for me, sometimes it's like if my condition was so bad that 90% chance antibiotics wasn't going to cure it, why not do surgery before instead of wasting time with antibiotics? And by this time, end of July, early August, I felt my health was sort of getting slowly deteriorating as well, even with antibiotics. To the point where I think antibiotics weren't making me feel better. I still felt low in energy. And this is when sort of I immediately reached out to other doctors and asked, basically, who's the best surgeon for sinuses? Luckily, we found a surgeon, ENT surgeon, in the Bumrungrad Hospital that is very well recognized, very renowned, and known for being the best surgeon for sinus surgery. So I think this must have been, around third week of August, and at that point, I remember I was finishing the course of the Kravit antibiotics. I thought I would be feeling better, but instead, I kept feeling worse. My nose was still stuffy. I was still coughing, and I felt that when I woke up, I didn't have enough oxygen. Like I felt that I couldn't breathe fully. I think it was because my sinuses were so blocked that when I was taking breaths, air wasn't fully going into my lungs. Even though my lungs were still, the oxygen level was still, 98, 90%, 99%. But the feeling is that you're taking these deep breaths that don't feel full, and you kind of start to panic a little bit, and you feel like you're just in trouble. I felt like I was in trouble in terms of not getting full breaths and everything. And the thing is, symptoms otherwise weren't that bad. I didn't have a fever. I could still walk around, but I felt my energy was really, really low. And this is when I quickly, went to the ENT surgeon right away. I remember this was on Friday. No, it was on Saturday. Saturday, end of August. I think it was maybe the 28th of August, I think. 27th, 20th of August. I mean, I went to see the surgeon on a Saturday. I brought all my CAT scan and x-rays. I told him, I've gone through hell. I've gone through months and months of antibiotics. I want to get the surgery. And so he looked at my CAT scan. And he's like, you're right. I think the doctor, who I saw, I mean, he's gone through hundreds of cases. And I'm sure he knows that once he took one look at the CAT scan, he knew that I need to get the surgery. But I think the thing was that surprising was that when he looked at the CAT scan, it was not only sinus surgery that I needed, it was also deviated septum surgery that I needed as well. I also found out that through the CAT scan, I had a deviated septum on the left side. So if you guys don't know what that is, it's sort of when your inside of your nose is sort of bent towards one side more than the other, either through birth defect or genetics or accidents, or I don't know. I probably had it since birth, but basically it makes airflow uneven on each side. So I was actually getting less airflow on the left side compared to the right. So he was like, you need sinus surgery and deviated septum surgery. At that point, I was somewhere whereby just give me the surgery. I was dying for surgery. Normally people are scared of surgery. At this point, I wasn't scared of surgery at all. I was ready to get the surgery. I told him, do whatever it takes. I don't care. Do all the surgery you need. He's like, do you have any questions? I was like, no, just give me the surgery. I asked him when's the soonest he can get the surgery. Give me the surgery. I saw him on Saturday. We had the surgery on Tuesday. So Saturday, Sunday, Monday, Tuesday. So I think this was a really good blessing that I got the surgery really fast. I remember after I saw him on Saturday, on Sunday and Monday, I felt terrible. I thought maybe it was just nerves before the surgery, but I didn't have an appetite. I still had very low energy. I wasn't sleeping well. I wasn't eating well. So I think I was very lucky that I was able to get the surgery very, very, very fast. And so this was, August. Was it August? Sorry, I'm remember correctly. The surgery. I finished the course of antibiotics in August. all of August, and then through August into September, and then I had the surgery end of September. That's right. Yeah, I saw the doctor in around 28th of September, and then had the surgery on the 30th of September. So from the time that I had this, since May, we're talking since March, April, May, June, July, August, September, 7 months of just pure torture, basically, ups and downs, antibiotics, to finally getting surgery, I think, on the 30th of September. And the thing is, with surgery, I'll break it down for you guys in case, there's any of you out there that are considering surgery or what to expect from surgery. So I think I've gone through the whole antibiotics part. I think if most of you have sinus infections and antibiotics have cured you, I think that's great, wonderful. But if you ever need surgery, I think this is what you can expect from surgery. So with surgery, it's, of course, nowadays it's endoscopic surgery. It's honestly, the surgery part was very, very easy. You go in, you check in, they put IV in you, and then you basically just lie on the bed, and then you just breathe in the anesthesia, and then you're out. You're literally out. You don't feel a thing. You wake up, and the surgery is done. And because it's an endoscopic surgery, there's no cuts on the outside of your nose. It's all sort of internal. You don't really, honestly, know exactly what they did inside your head, but I woke up. And I remember immediately my breathing was better. I think when they took all the infection material out, my breathing got better. So surgery part, easy. Surgery part is extremely easy. You only have to spend one night in the hospital, and then the next day you're discharged and you can go home. But then after the surgery is where another difficult phase comes in, because once you have the surgery, you need to wait about 7 days until you go back to see the doctor to get it's called like a debridement or something, where you go in and they suck in sort of blood clots and sort of any leftover material inside your nose. So after the surgery, you're on your own for 7 days until you see a doctor again. Those 7 days were hell. Man, let me tell you, I think if you're gonna get sinus surgery, make sure you practice sleeping with your mouth open, because after the surgery, the first night I was fine. I think because after the surgery, you're still on anesthesia. Everything is sort of has just been done, so nothing's swollen yet. But when you get back home, the second night, the third night, now everything's starting to swell. It's like, when you get your wisdom teeth and everything just swells, but now it's all in your nose. So, and during the surgery, the way they start the bleeding is they pack these dissolvable gauze inside your nasal cavities, inside your sinus and nasal cavities. So not only after the surgery you have swollen everything inside, but you have these gauze packets, these dissolvable gauze packets that makes everything worse. Basically, first 3 days you can't breathe through your nose. So that's what you can expect. You get some, first of all, you can't blow your nose because you've just had surgery. So all you can do is you do these saline rinses that really don't do much the first 3 days. And then they give you, you can use a decongestant. Do I have it now? It's the Liadin. I think there's different brands, but of course, a decongestant spray they can use once or twice a day at night. That helps some, but not all. The first 3 nights were terrible, were hell. You have to breathe through your mouth, and when you breathe through your mouth, I wasn't really used to breathing through my mouth, and your mouth just gets all dry, your throat just gets all dry. So I think if you're getting sinus, just expect that after the surgery, the first week after surgery, you have to be strong, push through those nights. Keep in mind that your lungs are fine, your breathing is fine. It's just having a bad stuffy nose. And then I think things took a corner when you have your first meeting with your doctor after the surgery. After 7 days, you go in and they do this thing. It's called they basically suck out all the surgery material and any sort of lingering mucus that's trapping any airflow. And at that point, you instantly feel better. You instantly get your airflow back. After that, you still get these stuffy noses and mucus building up, but they slowly clear away quite quickly with every rinse every day. So again, it's not like surgery is changing the structure of your sinuses inside, fixing the deviated septum. So it changes the structure to make everything better, but then you need time for those things to get better. You know what I mean? So like the structure inside, the pipes inside, everything, the cavities inside are all restructured to promote a more healthier drainage, more healthier flow, but you still have all those kind of gunk and swollen material, surgical material inside. So basically, following the surgery, day by day, it gets better bit by bit. So now I'm on the, 23rd day post-surgery, and my nose feels quite open, quite ventilated now. I think percentage-wise, my right nose feels like it's like 90%. My left nose, because it was a side with also the deviated septum, probably takes a bit more time to heal. It's probably still a bit swollen, so it's maybe around maybe 70%. But day by day, it gets better. Breathing gets better, energy returns. And again, it's not like an instant turnaround overnight. It will be sort of a gradual improvement day by day. You notice, I notice that one day I can run a lap, the second day I can run 2 laps. I get more energy during the day, but then in the evening sometimes I still get tired easily sometimes. So energy sort of comes back and builds back up as well. So it's the post-surgery part. It's post-surgery. The toughest part is, of course, dealing with the stuffy nose that gradually gets better, and also the constant rinsing. You have to rinse 4 times a day, and each time you rinse is like 250 mLs worth of saline solution. So each day you're rinsing about 1 liter of solution. So I've gotten used to it. I don't mind the rinsing. Actually helps. Every time you rinse, you sort of feel more clear. But just the feeling of flowing a lot of liquid through your nose, that's sort of what you have to get used to. I guess before you get surgery, if any of you who are looking to get surgery, before you get the surgery, try doing a saline rinse if you're used to that. Try slipping your mouth open if you're used to that, and that's sort of what you can expect. But overall, I think I'm on a path of better improvement, knock on wood, hopefully. I will be getting back to making more Thai wandering videos very, very soon. Again, apologize for not having the videos, just the recovery path and all the sickness, which is really, I didn't really have the energy to do any traveling videos. But, we'll definitely have some travel videos coming up this next few months, especially going camping, going to the beaches. So looking forward to bringing you guys back more Thai wandering videos. But what else I want to mention? I think what I could probably leave you guys with is, if you ever get a stuffy nose or a cold that doesn't go away after 4 or 5 days, seriously get it looked. I talked about this at my office at work, and I just realized that not only do a lot of my colleagues have had these sinus infections, some of my colleagues have even had the same surgery, and also some of my partners who I work with, have also had these surgeries. So sinus surgery seems to be not as uncommon as people think. I think maybe it's because of today's pollution and everything, but I think take cold seriously. If you don't get better within 5 or 7 days, seriously get it looked. If you think you have a sinus infection, seriously get an X-ray. See a proper ENT. Look into the history of the ENT if they're well experienced or not. So hopefully you guys have learned something from this video. Maybe looking back, I'm just sort of wondering what could I have done to avoid surgery. Maybe if I would have gotten the full course of antibiotics first initially, then maybe the infection wouldn't have progressed so badly. But then again, at that time, the idea of having a heavy sinus infection never really crossed my mind. So hopefully you guys can learn a lot from this video. What I would say is that, all this time, I think a lot of us in the past 2-3 years have been so focused on COVID and flu A, flu B. Honestly, I've had all those. I've had COVID, I've had flu A. On a scale 1 to 10, COVID and flu A ranks maybe about a 3. Sinus infection is probably about 11. I think it's the fact that sinus infections can drag out for many, many months and basically eats into your motivation, eats into your energy, destroys quality of life, and eventually by the time you succumb to surgery, it's been several months. So yeah, that's all. And I am looking forward to doing more videos for you guys. And yeah, hopefully you've learned a lot. And you have any questions, just leave me some comments. And looking forward to bringing you guys more Thai watering videos. And if you like this video, please do help subscribe and share for knowledge, I think. And okay, see you guys next time. Bye bye.